Hi, this is a very nice day, and we're very lucky today. We are with a very famous ENT specialist, that's ear, nose, throat specialist, who has worked a lot during all his life, especially for cancers of throat region. And hopefully he could be available for us and share his experiences about cancers of ear, nose and throat region. Dr. Hakan Korkmaz is a very well-known specialist of ear, nose, throat diseases, especially on cancers of this region. And before beginning our conversation and negotiation about laryngeal cancers, can you talk about a bit about yourself after Hacettepe University? What have you done? You have been in very famous places to study specifics of cancer. Can you give some samples about that?
Thank you very much, Professor Güler, for your very nice words. Actually, I have been studying and working in the area of head and neck cancers, I can say, for the last 25 years. After graduating from the ENT department program of the Hacettepe University, I did fellowship, 2 years of clinical fellowship in United States at Michigan, at Wayne State University in Michigan. So it was a great experience for me, and after that experience, I can say that I gave myself to this area, the head and neck cancer area, and since then I have been doing lots of surgeries in this area, and we are a team, actually, head and neck cancer team, which includes medical oncologists, radiation therapists, pathologists, radiologists. So we have been working together for the last 20 years, and we are trying to do good things, of course, for our patients. When we say head and neck cancer, as you explained, these cancers are the cancers located above our shoulders, except the brain cancers. So any neck cancer, thyroid cancer, voice box that we are going to talk today, oral cavity, which is tongue and nose, the base of tongue, so all are included in this area, actually.
Excluding the brain cancer, everything above the almost shoulders is yes. Your area. Yeah, that's very good. And you have a very efficient team over there. Most of them you have raised, indeed. Let's begin with those voice box cancers. Is there something we can avoid not to get these cancers? What's the etiology? What can we do to avoid these cancers?
Voice box, in medical terms, we call larynx, is a very important organ, of course. So, which produces our voice so that we can speak, and it also help us to swallow, and it also protects our lungs. So, it's a very important organ. But unfortunately,
when you say protects
the lungs from aspiration.
Aspiration
yes,
of the
yes,
food,
because it closes when we are swallowing fluids, water, or eating the foods.
I think this is also very important in your surgeries too. To protect this
we have to preserve that function as well. And but unfortunately, we see the cancers of the voice box, of course. We see these cancers mostly after 40 years of age, and the main etiology is the smoking. Heavy smoking is very closely related to voice box cancers. When we say heavy smoking, it is more than or at least 1 pack a day is a heavy smoking, And if somebody is smoking for the last, let's say, 20 years, he or she has a very decent risk of having a voice box cancer, especially if there is a history of cancer in the family, in the close relatives, the cancer of voice box, the risk increases actually. So main thing is the smoking, cigarette smoking.
If the person quits smoking, does it help him?
Well, of course it helps. Everybody should quit smoking. But to clear up, to clean everything, I think at least 5 years should pass. Yeah, if the load of smoking is very high, let's say 2 packs a day, and for 40 years, so it is a very heavy load. So it takes more to clean that. We see cancers of the laryngeal cancers, voice box cancers in people who are smoking, but we also see in those persons who quit smoking in the last 1 year or 2 years. So that's not enough actually. So at least 5 years should pass, I think. But everybody should quit smoking.
It's better not to smoke at all,
it's not,
but when possible, quit smoking.
Absolutely.
For everything indeed. Smoking, okay, but are there any factors? For example, gender. Is gender important? Males or females, are they affected equally?
Males in our country and the Western countries are 5 or 6 times more we see voice cancer. But probably it's not gender related, but it's related again to smoking. In our country, mostly the males are smoking, but in the last 10 to 20 years in our country also we are seeing females also having voice box cancer as well. But we can say that in summary it's a disease of the males who smokes. Is there a possibility that a voice box cancer can occur in a person who has never smoked? It's possible, but it's very, very rare. It's very, very rare. Almost all of them have a history of smoking.
It's not a rule that all smokers will develop a laryngeal cancer, but one who develops is probably a heavy smoker and male.
Yes.
Okay.
Yes.
And I think age is also important.
Yes.
Do we see it in children or
we never see this cancer in children. Maybe in the ages after 20 years, very rarely, but mostly we see it after 40 years of age, and very, very frequent after the 50 years of age. Actually, it's an adulthood disease. Actually, it's again related, I think, to the smoking as well. Yes.
We said that it's a smoker disease, but every smoker does not develop this, fortunately. Who must suspect of having a problem in his laryngeal area or larynx cancer? What are the symptoms of this disease?
We are very lucky that it gives symptoms very early. And the most important symptom is the loss of voice. We call it hoarseness, distortion of the voice. If somebody has the hoarseness, an adult who is smoking, lasting more than 2 weeks, there should be an alarm. That person should go to a doctor, an ENT, ear, nose, throat doctor, and have the examination of his or her voice box. That's really very important to go after 2 weeks. But the upper respiratory tract infections also cause some distortion of the voice, but it lasts like 2 days to 5 days, maybe 1 week. But if it is more than 2 weeks with the history of smoking, there is an alarm for the laryngeal cancer.
Oh, I see. When you say hoarseness, can you describe it more simpler? For example, is my voice hoarse? Or what do you mean as hoarseness?
The hoarseness is the loss of the quality of the volume of the voice actually. So the person, yes, it decreases, the voice decreases, the quality is lost. So the person gives more effort to make voice, to produce voice and to speak. So once you experience it, you will know it. a person, something is wrong with my voice.
I see.
Yeah, when the person thinks that something is wrong with the voice, so if it is again more than 2 weeks, it's an very important sign.
Even a friend may recognize the condition.
Yes, of
from
course.
this
A family
frequency.
member, a
Yeah.
friend may recognize, and
There's a change in your voice.
Yes, they
This
should
is-
say that you have to go to a doctor because this is
very
not normal.
That's very good. Okay, let's go to the doctor. But you're going to the doctor late or early, does it differ?
Well, it's a general rule for the cancer. If you go early, if you catch the cancer early, so we have the high possibility of curing the cancer, and with the least efforts, with the smallest operations and treatments. But if we catch it in the advanced late phases, the chance of treatment and the type of the treatments changes, of course.
I see. But before that, let's talk about diagnosing. How
Yes.
do you diagnose the cancer?
When the patient comes to our office, in our routine practice, we always look at all the nose, throat, and to the voice box, of course. And we have special instruments, endoscopes, either through the mouth or through the nose, flexible endoscopes we have. I usually use both of them if there is a problem with the voice box. So on the screen, very high resolution screens, we can see all the details of the voice box, the vocal cords, voice cords, and the lesion. If there is any lesion, we can see it very well, actually. So we examine the patient with our very special instruments, high resolution endoscopes, and on the screens we see all the details of the lesion, voice box, the vocal cords, voice cords. When we suspect that there is a lesion, like the one on the screen, on the right side of the screen, there is a lesion. And when we see such a lesion, we decide to biopsy, to get some sample of tissue to make the exact diagnosis. So before going to biopsy, we get some scans, either MRI scan or computed tomography scans.
In order to understand the extent.
Yes, very good. Yeah, the extension of the disease with contrast materials. So we try to define the extension and the limits of the disease. And when we come to the step of the biopsy, we do it under general anesthesia.
Can you stop at the level you see that lesion to show it better?
Yes, let's make it like that. Right here, the white lesions on the right side, the white lesions.
White areas are
White
pathological.
areas are suspicious areas, and they are cancer. I know the biopsy result. So if we see such lesions, white vegetative lesions, this is a very early case. And the left one, the left cord is normal actually. The one on the right side, there are lesions. So it is located on only one vocal cord. There are two vocal
For
cords.
better orientation, we are looking from upwards
Upwards.
to the line.
Voice box,
The
yeah.
downside is downside of that lung part
Is
lung.
trachea.
Trachea.
Yeah.
The pipe going to
pipe,
the lung.
the breathing pipe.
The proximal part is tongue.
Right.
And here we see voice box. Indeed,
box,
the
right.
shape.
Right.
And this is the
Very
right
detailed.
side.
So we clearly see the lesion.
Yeah. In exact anatomy, what is the length of?
It changes for the males and females. In males, it is between 1.6 centimeter to 2 centimeter.
Yeah.
But in
We see a
females-
very huge thing here,
Yes.
but this
It
area
is
is
2
just 2
centimeters.
centimeters.
2 centimeters.
And these lesions are at most totally 1 centimeter.
Yes. Yes. Yes.
You make a biopsy from
Yes. Yeah. We make a biopsy. We put this patient to sleep under general anesthesia in the hospital, in the operating room. Then we make another examination under general anesthesia. We have special instruments again, and then we get tissue samples, so biopsy, and then we send them to pathology. And then when the pathology approves the result, it says that this is a cancer, we make our treatment plans.
You do the biopsy always in the operating room?
Yes, always.
Under general anesthesia, the patient is quite relaxed, so
we go through the mouth. We
Very
don't
good.
make any incision to the neck.
I
We
think-
go through the mouth and get the biopsy from the mouth.
with the rigid
Under
ones.
microscopes, we have
Very good.
operating microscopes. So we get also very detailed definition of the lesion at that.
All these efforts are just not to harm the patients
Right.
and to have an exact diagnosis. Very good, exactly. So, if you find a larynx cancer, what do we do? Can we treat it? Are there any option? I think there are lots of options indeed, especially in current days. What can we treat? Can we treat larynx cancer first?
We can definitely treat larynx cancers, voice box cancers. I tell to my patients that if somebody is smoking and if there's a genetic or familial risk of cancer, those who are lucky will have voice box cancers. Those who are not lucky will have lung cancer. The most unlucky ones will have both of them. Sometimes we see both. So if there is a voice box cancer, it is treatable. But the main and very important thing is when the stage of the disease. So if we catch it in the early phases, early stages, we have a great chance of treatment and without giving too much harm to the voice box. But if we catch it in the advanced late phases, the chance of cure goes down, and sometimes we have to remove all of the voice box. So in the treatment of the voice box cancers, there's a wide spectrum actually from surgeries. I will give the details of the surgeries, and radiation treatment, and sometimes we give chemotherapy, the medicines, IV medicines with radiation to cure the advanced cancers. The main thing, as I said, is catching in the early phase. So this is an early phase actually. We have 4 phases. The first phase, stage 1, is the earliest. Stage 4 is the latest, most advanced. Which means that sometimes it is very huge. There is a huge cancer. The cancer is like a small apple in the voice box. It distorts voice, but also distorts the breathing. Sometimes we have to make a hole, emergency hole to the pipe, the breathing pipe, and sometimes it may be very huge that it goes out of the voice box to the neck. So this means a very advanced phase. But we are lucky that in our patients we can catch them in the early phases most of the times. So when we catch it in the early phase, we have a very decent, very reliable way of treatment, and in the last 20 years it has been very popular in the developed countries, Western countries, and also in our country, which is the laser treatment. I can give details of the laser treatment. Again, like doing the biopsy, we put the patient anesthesia, under general anesthesia, in the operating room. We go again through the mouth. We don't do any incisions in the neck, no hole. And we using the laser, we remove the lesion totally, and we try to preserve the important parts of the voice box. So while removing the cancer, we can also preserve the voice as well most of the times, if it is very, very early. But it is somewhat advanced, like it's a stage 2. We may preserve the voice a little bit less, but again, voice is preserved and larynx is in the throat. But in the very advanced cases, unfortunately, the surgery is to remove the larynx. We cannot use the laser. So in the stage 1 and 2, and sometimes in stage 3, we can use the laser and remove the tumor through the mouth. And it is a very nice operation. We operate today, and we keep the patient 1 or 2 days in the hospital, and we send them home. They can swallow very comfortably, no problem of swallowing fluids or eating the foods. But the voice gets little more distorted. But in 3 months, it really gets very well. Yeah, it gets better, and so the patient will have a decent voice, and also he can get rid of the cancer. In the early phases, we have a cure chance of more than 90%. And it's a very, very, very good percentage. And like for this patient, stage 1, we have 95 to 98% cure rate actually, while preserving the voice.
Almost all of the patients can get cured,
yes,
and preserving the voice, and larynx is at its place.
Yes, this is very important.
For better understanding, larynx is the just above the main pipe that goes to trachea.
Right.
That enables us to breathe, and to live we have to breathe.
Yes.
And this is very important. So if you take out larynx, which you sometimes have to do in advanced stages of laryngeal cancers, what's the problem? Can the patient breathe? Can the patient speak? I think speaking
is not possible, right? When we remove the larynx, we make a permanent hole in the neck. Yeah. So we suture the breathing pipe, the trachea, to the neck. Yes, if there is a hole here, it's a permanent one. So these patients can comfortably breathe, no problem of breathing. They can comfortably swallow, because we suture the pharynx and make a esophagus. Yeah, so there is no problem of the swallowing, but there is no voice, of course. For that, to restore the voice, sometimes we use silicone prosthesis. After the operation, couple months later, we put prosthesis to the posterior, the back wall of the trachea, so they can put their fingers in that hole, and then they can talk. But to tell the truth, and this is a life-saving operation. If the patient is at the advanced stage, of course, this is a very, very good way of treating the patient. So the patient should not run away from total laryngectomy, this operation. If an experienced surgeon, an experienced doctor offers this actually. But one other thing is, in our country, in the Western countries, if the tumor is very advanced, we remove the voice box. But if it is not very, very advanced, but the laser is not suitable, in such cases, we are not removing the larynx, but we are applying non-surgical treatment with our radiation oncology, medical oncology colleagues. We give radiation and IV medicines, chemotherapy, and there is a high chance of like 60 to 70% of the cure rate with that treatment again. And what we call is the organ preservation treatment, or chemoradiation treatment. It's also a very decent way of treating.
Dr. Akan, these are very interesting subjects, but let's talk this further before a short break, after a short break.
Okay.
Okay, thank you. Dr. Hakan, thank you again for being with us today. And you have mentioned lots of very interesting things. In our residency time, there were very huge surgeries and very aggressive surgeries. And lots of people came with holes in here. Of course, this is a life-saving surgery, but losing voice is something you don't like. Again, the patient can breathe from here, but God has created something different. We mainly breathe from nose, not mouth even. This also gives us some advantages. What are the problems we see when you open a hole in here? Of course, you have made a life-saving surgery, but breathing from nose is better than breathing from a pipe from here. What are the differences between these two breathing methods?
Well, the main thing is you lose your voice box. You cannot produce the real voice actually. And also you lose most of the functions of your nose. So, because you are breathing through the new hole. So it's a kind of difficulty in the quality of life, the way of living, the social ways. And if you are a professional, let's say like a teacher, doctor, it is more difficult to continue with your professional life as well. So God has done the best job actually. It's a great organ, larynx. So we must preserve it if we can preserve it. As you said, during our residencies like 25 years ago, in our department, I remember that we were removing 90% of the voice box of the patients with voice box cancer. So this is very high rate. But in those days, there was no other choice actually. So even in the early phases, we had to remove the voice box. Now,
what is this number now?
Now I can clearly say that in a good center, the rate of removing the voice box should be less than 20%.
Really?
Yes, really.
You can preserve,
at
least 80%
of the time of the patients of the voice box while we are treating the cancer as well. So it's a treatable cancer, and we have to preserve the voice box as well. So in advanced cases, again, before removing the voice box, we apply radiation and chemo in advanced cases. But the main thing, we catch the 60% of the patients in the early phase actually. When we catch the patients in the very early phase, so we have a great tool today, the laser treatment. As I told you, with laser treatment, it changes from the patient to patient, from the lesion to lesion. It's a stage 1, stage 2, or stage 3. So it takes sometimes 1.5 hours, sometimes 3 hours, sometimes 4 hours. So we work very detailedly, very diligently through the mouth under microscope. So with laser, we remove all of the tumor out of the mouth. So we don't do anything on the neck actually, no hole.
No hole, and no incision.
No incision on
very
the neck.
Good.
So the other advantage is when we compare it with the open surgeries, we have been doing lots of open surgery, partial open surgeries. It's also possible. Sometimes we open the neck, put a temporary tracheostomy hole in the pipe, and do open surgeries. But with this surgery, we do it under the microscope. So we have a high resolution view of the tumor and the normal tissue. So we can make the differentiation. So we preserve the normal, we remove the cancer tissue. So we have to put a safety margin as well. So with the microscope and the laser, we can put it very, very detailedly. Exactly, actually. So, after that, as I said, we send the patients 2 days or 1 day after to their home. They can start swallowing, eating, and the fluids, foods, everything.
Everyone can eat and drink.
Yes,
everything.
Almost 99%. Sometimes 1% of the 1 to 2% if you do a very huge resection through the mouth. It may take some time to swallow, but in the end, they all swallow normally. And the breathing is okay. We have never had to put a temporary hole to these patients, and they have an excellent passage of the breathing. And it takes three months to get well. Once after 3 months, the tissues get well, and then the voice comes back most of the times. I can say 90%. But if the lesion was big in the beginning, the patient may still experience some kind of voice distortions, but not like the one with the tumor. So it's a very reliable, dependable, both oncologically and functionally surgery. So we use it comfortably from our heart. So the patients are really very happy, those patients undergoing this operation. So laser treatment of the voice box cancer is a very efficient method of treating cancer.
Dr. Hakan, thank you very much for being here today. I know you are a very successful surgeon and you are using advanced techniques in your clinic and teaching your students everything about this subject. I know you well, but our audience may want you to know better. What's your success rates? What's the usage of this laser treatment in all over the world, including Europe, etc.? And what's your clinics and your success rates with this technique?
First of all, I can say that we are one of the most experienced clinics in this area in the treatment of voice box cancer overall, and also in the laser. We are very experienced. We have lots of patients, and we have written lots papers on this. Mm-hmm. So if we catch in the first phase, the patients in the first stage, we can cure more than 95% of the patients. But if it is in the second stage, the rate is around 90%. If it is in the third stage, it gets to 80%. But in the advanced cases, it changes how advanced it is. But sometimes for these patients, retreatments may be needed, reoperations may be needed. So as a team, we do all of this, the necessary extra treatments, adjuvant treatments as well. And I believe we have very good results, and our patients are very happy with this kind of surgery. And there are some patients that in the borderline, they may need total laryngectomy, voice box removal, or partial surgery. There are sometimes patients are coming from all over Turkey and sometimes from outside Turkey that some surgeons offer voice box removal. But if the lesion is suitable, if the patient is okay, we are also doing this surgery, laser surgery, and removing the tumor transorally and making the patient happy. I think the patients, those patients with this disease, should always search for a second opinion. If the suggested treatment is voice box removal, they should look for another opinion. Is there a way of treating this without voice box removal with either laser or other chemoradiation treatments as well?
Very good. Then we can easily summarize that this is a two-part problem. One belongs to the medical doctors. You say that your clinic is extremely experienced and have lots of machines to do lots of operations easily, and from the beginning to the end you can easily manage every patient. The second part belongs to the patient. If she or he recognizes his problems early, she has a very good chance of complete cure, indeed. And in a very fragile region that makes you breathe and speak. Thus, if she or he can be careful, he or she can come early, be diagnosed early, and has the treatment effectively, easily, comfortably, and in a very cheap way. Right. This is very good.
Yes.
Then let's do not wait for the symptoms to be worse and visit an ENT specialist and have the diagnosis and appropriate treatment as early as possible. This will be the best, cheap, and effective way to do everything. One last thing before closing. For any patient from outside Turkey, can they reach you? They can also reach through our channel 2. Natural TV has a asking question asking WhatsApp number. They can easily send our questions to us. This also may be a channel for you too. Can they ask you about their problems, whether if they come here, can you be more helpful to them? Can they reach you easily? Indeed, I am asking because of the COVID area, lots of people cannot travel easily. Thus, they want to know if there is something to do more, something to do better, I can come over there. Is there any way to reach you? This may be online visitors or any other channel.
Yeah, I understand very well the question. This is happening actually, even all over Turkey and sometimes outside Turkey. We use both emails and the WhatsApp applications. WhatsApp applications, of course, very suitable. Patients send us the reports and also the videos of their examinations.
Very good.
If we can also see the reports plus the MRI scans and the tomography scans, so I can make a rough estimation if we can give a laser treatment and early treatment or not. So this is a very decent and good way actually. So if early treatment, laser treatment is not possible, we say that to the patient, okay, stay there. Just go to your doctor and get your voice box removed. But if there is a chance of laser early treatments, so we say that come over here. We should look once again. There is a. It looks like that there is a chance. So this is a great opportunity, of course,
Indeed, to get the video for the patient, for your students too. There are lots of people you have raised and sent to all over the Turkey, and lots of others maybe outside Turkey too. I think they are also calling you and asking your advice about the patient's conditions. This is a very good opportunity.
Definitely, and sometimes the outside patients, outside Turkey patients, foreign patients, we operate. They go their home. They have ENT doctors there. They do the controls. They get the video examinations. They send us. Oh, okay, that's very good. Just stay there. Get your examinations there. You may come 1 year later to us. So, of course, we have also online examination opportunity as well in our web area, web page. So the patients can always consult us for this kind of problems, of course. Thank you very much. I have been very happy to be in this conversation with you, in this talk actually, so I would like to do it again. Last word would be, please don't smoke.
Please don't smoke.
Or if you are smoking, quit smoking as soon as
possible.
So, and I wish good health to everybody, and they can consult anytime if they have any kind of head and neck cancer problem to us, of course. Thank you very much.
Thank you very much. Have a nice day, Africa.